doctors. And that's why I'm very keen on inviting Radhika Sachdev. She has a lot of first-hand experience and angst as to what has happened. And based on this, we hope that this experience will get transmuted into something which is good for other people as well. Radhika?
Yeah, thank you. I speak from personal experience, and what makes it very painful for me to be standing here not as a representative of my community. I'm a media person, but I represent a patient today, my mother. She expired on September 8th, and the cause of her, the loss of her life, not caused by her primary illness, but by her secondary illness, the septicaemia that she developed during the course of her treatment at Max Hospital, Noida. My mother, till the time she was conscious, she tried to communicate through various non-traditional ways. She tried to write notes to the doctor. She tried to communicate with the nurses. But because they didn't have a training in that sort of a... The most unfortunate, in retrospect, I feel that the most unfortunate part about such experiences is that you learn that you are better informed in hindsight than in foresight. But one of the purposes of holding such a conference, I feel, is that your foresight becomes better, hopefully, over a period of time, and you learn to communicate. Doctors are a very empowered lot. They wield the knife. And we, as media people, also feel we are very empowered because we wield the pen. But the help... How do I take it forward? That's my mother with us. How do I... She was very health conscious. The irony is that she was a fitness freak. She never missed a day's exercise. She got admitted for gallbladder removal surgery. And septicaemia was nowhere mentioned in our discussion with the doctor. It wasn't communicated to us. This is supposed to, later we learned it's a post-surgical complication which is related more to the hygiene conditions of the hospital than anything else. Yeah, she attempted flying fox when she went on a holiday trip with us. We sat there outside the ICU, hoping that somebody would step out and begin to explain, de-jargonize the whole process, demystify what was happening. She was kept in the ICU for almost 4.5 hours, when an ordinary procedure would have taken just about half an hour. But what was the doctor doing inside the ICU? It was not communicated to us. He came out, he apologized, he said he didn't have the time to take an informed consent. ARDS, that's another word we learned, a lingo we picked from the doctors. I wrote to the ARDS Foundation, and the person there, the president, she responded. She tried to bridge in the gap. She tried to communicate with us, but there was no empathy or understanding that flowed from the staff that was supposed to take care of her. Thank you. I'm still very emotional about the whole experience, so I'm sorry if I haven't done justice to...
You know, I mean, I think this is something we need to learn, that when things happen, hopefully, you know, part of the problem is we only learn from our experiences when we have problems, and what we're really trying to do is prevent some of these problems by learning from other people's experiences so that we're not on the receiving end.